عليكم، معك فاطمة المنصوري. أنا اليوم في مستشفى الشرق الأوسط ومع دكتور باولو. Today we're going to talk about integrating yoga with plastic surgery.
It's a pleasure to be here, and I think I have more questions to you than you to me, because I think it's really important, this kind of integration between surgical field and yoga, especially because, you know, when the patient goes to a surgery, sometimes they are a little bit nervous, they are anxious, you know, so I think that together we can work well, always thinking the best for our patients.
Yeah, the pre-surgery anxiety and stress usually is a common thing. I'm sure you notice it a
Very
lot.
common.
Yeah, and sometimes people
Very common.
suddenly feel like so how what's the, let's say, the level of anxiety or stress that you notice usually?
Of course, each patient is different. We have those ones that are already adapted with this situation, especially those ones who did surgery already, maybe a bariatric surgery or even another plastic surgery. But I always have a kind of anxiety there, you know, and of course, it's much better when the patient goes to the operation theater already prepared.
Relaxed.
Relaxed.
Yes. This is why actually when I was looking in regards of this subject, there are a lot of research studies that actually talk about the need for such or the importance also, because of the how the anxiety can affect the results also for the patients. Yeah.
Yes, because there is anxiety by the procedure by itself, but also there is anxiety about how will be the journey and which result the patient will achieve, you know. So the anxiety can be before and after the procedure.
Yes.
As well, you know, because there are sometimes there are
The
expectation is very high,
yeah.
you know.
So yeah, this is why it's important to integrate, as you said, and especially since you asked me a few minutes ago also about yoga being an exercise or not an exercise, but you were totally correct. Yoga is not really just postures or exercises. It includes a lot of beneficial techniques, especially the breathing techniques, which I totally recommend for the patients to start learning these techniques so that they can benefit from the breathing, the deep breathing and relaxation before the surgery, so that it can reduce the stress and anxiety that comes with that, and then after the surgery as well, so that they can continue having peace of mind.
When we should start this one, you know, because most of patients, they come to us 1 or 2 consultations before the surgery, you know, and sometimes we can identify this anxiety, but sometimes we cannot, you know. So I would like to understand when we can start and how we can identify these patients.
I mean, if they start as soon as possible, like the breathing techniques can be helpful for the well-being, the overall well-being, and it can be utilized for such in such cases or such situations, you know. So a person should have a basic understanding of how to use the power of breathing to relax and calm down, so that it can help them throughout their life. So it is not a matter of when to start. They can start right now with us. We can begin with breathing technique that is very simple. Like, for example, just sit straight, close your eyes, start focusing on your breath and notice your breathing. You should not basically force the inhalation and exhalation out, just as you are sitting right now, the way you are sitting. Just try, if you can, extend your spine a little bit and feel the expansion as you inhale. It should be more of abdominal breathing. And as you exhale, it's preferably done when spine is straight, so that you can feel the movement. They can place their hand on their chest and the abdomen, and they can start with the deep breathing, where they will feel the lower hand moving as they inhale, and then going inside, collapsing as they exhale. And then when they learn this technique and continue to do it and slow down the breathing as much as possible, the slower the better, and then the duration of the inhalation and exhalation should be long and slow. This technique can help them to improve the overall well-being, and then they can use it in such situations when there is an anxiety or fear or stress. It can very much help, and there are plenty of research that shows how helpful it is for such cases. Even actually during the surgery, we were laughing and saying there's nothing much they can do. So this is why it's important to do before, because this is all like wiring for your brain and reactions and nervous system and everything.
Great. But we know there is a lot of benefits regarding the anxiety, and there is other benefits about yoga before the surgery or even after surgery. What we can do more to, or even during the surgery, if we prepare the patient before. What are the benefits of yoga in surgical patients?
Usually, I have seen plenty of research in regards of the healing also, because when you are breathing better, you're allowing your body to even heal better, the tissues better. They use these hyperbaric rooms, and in countries where they don't have that budget for it, they use the breathing technique. And I've seen a lot of research papers that they use the breathing technique, especially the yoga breathing technique, instead of the oxygen therapy, the hyperbaric chambers and all of that. And it has proven to be just as, or maybe even more effective, because then the person will learn that, and then they can continue to implement and use it throughout their life. And the awareness of breath is really important, because once you know it, you cannot unlearn it. It will be with you and will help you.
So there's two situations that I would like to know from you, how we can deal, or what the benefits that can bring after surgery. First, it's after breast surgery. Why? Because when we do the breast reduction, before to do actually the patient, the main complaint is regarding back pain. And we know that the patient has not so good posture after surgery. How the yoga can help to fix this posture. And the second thing is regarding the tummy tuck. Because when we do the tummy tuck, we have to fix the abdominal muscle, especially the rectus abdominal muscle. But we are always explaining the patient that they need to do something after the surgery to make the muscle strong, to fix the posture as well.
And something that is not too simple, and which is exactly yoga, So something that can tone the muscles without putting a lot of strain,
Exactly, because this one will interfere with the final result, the late result after 1 or even 2 years.
Definitely, yeah. This is a big mistake when somebody's going for this surgery, because this is a lifestyle redirection. People come and do the surgery and then they think that that's it.
Everything done.
But this is not done. This is just a redirection. Now you have to pick it up and you have to continue with healthier lifestyle. And this is usually when they go out of the doctor's office, you will tell them the recommendation for the healthy lifestyle, but it is very much, you will see that they are not following after a while.
Because actually the result, the surgery, let's say, it's not one thing, it's a journey. It's before, during, and after. And this time it will be longer, and the patient have to keep.
And they often have complications because they cannot keep healthy habits.
They can lose the result.
Yeah, they lose their results, their money, their time, the pain, and the trauma that they've gone through for the surgery because they did not follow a healthy lifestyle. So again, when they start, because yoga is not just an exercise, again, it's like a lifestyle. So when you learn it, you can do it anywhere, from any place. So this will be easier for you for continuity, so that you can sustain the results, because most people also will join a gym and then they will not be able to continue. So why not learn the basics and do it at the comfort of your home, or whenever you're traveling anywhere nice. It would be nice a really nice integrated service to support the patients. And again, as you said, with the breast reduction, because of the postures, most doctors will think that the weight is actually affecting the spine, but as we were talking also earlier,
it's more patient unconscious. They try to hide
slouch,
the breast,
so the
and then they
posture,
can have
because
back
of so they try to kind of hide the insecurities and all of that, or it can be just the excessive weight, but as you say, it's not likely the weight, it is the weight and the posture that is affecting, not only the weight. So when after doing the surgery, you will still notice slightly they're opening up, but they still need the correction because they've been living for many years with the not the correct posture. So with all of this,
this one is work.
And it can affect the spine big time.
Okay, and regarding the tummy, of course, again, yoga is not only exercise; it's a lifestyle, but we have to adapt the exercise.
That which we call yogasanas or postures.
Is it the same exercise or posture if the patient did the surgery or not, or we have to correct?
There must be some kind of
to adapt.
Because we need to be very careful, and especially after the surgery. Sometimes we will not recommend after 3 months, at least of the surgery, of course, but I would totally recommend doing the other part of yoga, which is the mental and the mindfulness and all of that. But the physical, depending on the doctor's recommendation, 3 to 6 months when they can start. And some of the postures are very gentle that the doctor will probably recommend sooner than normal or strenuous exercise, and that can help the patient get back on track quite faster. And there are a lot of core exercises, even the breathing itself, it can engage the core, and it can it will be good beginning for the journey.
Great.
Thank you so much for being with us.
Thank you.
And hopefully we will be talking about other very interesting things soon.
Sure.
And I will be asking you a lot of things about plastic surgery. I'm really curious about it, and and then I can't wait to talk to you about plastic surgery and the mental part of it, the self-care and mental part, and how how natural the things you are using for some of the procedures and all of that. I'm really excited.
Will be my pleasure.
Thank you.
Thank you.